Certified, based here in London in the UK. And our topic for today is called Mild Cognitive Impairment, MCI for short. So today we'll look into that and try to understand this topic. And then we'll also come to the symptoms, the indicators, the signs, how you know that you got mild cognitive impairment. It's about the brain, and it can affect everyone. And we also get to know the causes, what brings about it, and then the risk factors, what can lead to that. So the difference between cause and what can be like a fertilizer, or what can be like a tool that can bring about this mild cognitive impairment. Now, when we say something is mild, it means it's not severe. And cognitive relates to mental functions involving thinking, planning, and understanding. So when we say cognitive, it means it's about mental functions. It's the thinking, planning, understanding, remembering, right? And the impairment means not working as well as it should. That is meaning by impairment. So mild cognitive impairment, I just explained the word for word, but we're not going to go into it. We're going to details of what really is mild cognitive impairment. So impairment means, of course, your mental function is not okay, but it is not severe. It's not severe, but it's not working as it should be. Right. Now, before you understand mild cognitive impairment, you should understand what is dementia. Now, let me explain dementia. Dementia, in a simple term, is the loss of cognitive functioning. The loss of cognitive functioning. It means the thinking, remembering, and reasoning to such a degree or to such a point that it interferes with a person's daily life and activities. Right, that is dementia. We know about it, we hear dementia. It's something that is really common these days, especially in the Western world, because of lifestyle. It didn't used to be so common, but dementia is something that is really damaging to one's life. Some people with dementia cannot control their emotions, and their personalities may change. Now, dementia ranges in severity from mild stage, when it's just beginning, to affect the person functioning, to the most severe stage, when the person must depend completely on others for basic activities of living. Right, so your daily life, you will need somebody, a carer, to take care of you. So it starts gradually. So it is degenerative. It gets just worse with time. So dementia is more common as people grow older. But remember, is not a normal part of aging. It's not. It's a disease that, alongside as we age, some people, depending on your general health and your lifestyle, this can happen. So many people live into their 90s and even beyond without any signs of dementia. Now, there are several forms of dementia, including Alzheimer's disease. Now, Alzheimer's is the most common cause of dementia. It contributes to dementia about 80%. 80%, right. Now, I'm explaining this because that will help us understand what is mild cognitive impairment. We will understand that very, very, very soon. It's very, very simple. Now, remember, as we age, we have some gradual mental decline. That is a cognitive decline. But it is normal. It is normal. For example, the ability to learn new information may be reduced. Mental processing slows down. Speed of performance, ability to become distracted increases. But however, all these things wouldn't stop you or to perform your normal daily activities. So normal aging does not affect recognition or intelligence or long-term memory. It doesn't affect it at all. So in normal aging, a person may occasionally, we say occasionally, forget names and words and misplace things. It is normal. But with mild cognitive impairment, the person frequently, this is different, frequently forgets conversations and information that one would ordinarily remember, such as appointments and other planned events. You see, so when we talk about what is really mild cognitive impairment, it is something a little bit higher than the normal aging, forgetfulness, and misplacing your keys on your mobile phone, because you do that just sometimes, when that is the aging process. It's normal. You can't remember some names, you can't remember where you put your keys or mobile phone. It's just normal. It wouldn't stop you from your daily activities at all. But in this condition, that is the mild cognitive impairment, it is frequent. What I've mentioned is frequent, but it's also not so serious, so severe as in dementia that you need someone to help you. So it's in between the normal aging, forgetfulness, and the extreme dementia, which I've explained to you already, because it's a loss of the cognitive function, the ability to remember, the memory, your thinking, your planning, it's your reasoning. So you need someone to depend on. That is extreme. So now, mild cognitive impairment is something that is not as severe as dementia and is not also as less serious as an aging process. That is it. But if somebody has mild cognitive impairment, among some people, it could lead to dementia. That is according to studies. Right. So we shouldn't underestimate mild cognitive impairment at all. Now, let's come at this point to the symptoms of mild cognitive impairment. But before the symptoms, let me put this number on the platform. You may be suffering from normal aging memory problem. You can't remember words, names, you misplace things, and you're not happy about yourself. You need to boost your memory. You need the nutrients for your memory. You need that help. Just give me a call. It may not be even mild cognitive impairment or dementia or Alzheimer's, this more serious one. If you got them, I'll be in a good position to help. And apart from about the brain disorders, if you have other chronic problems, diabetes, high blood pressure, heart problems, kidney weakness, you're on dialysis, hepatitis, skin problems, just call this number. It may not be you, share the number, be a blessing to someone, and God will bless you for that. I tell you, it's a cycle. The blessing is a cycle. The number calling outside the UK is +44 738 464 7300. This number again, +44 738 464 7300. Calling within the UK is 0738 464 7300. Calling within the UK once again, 0738 464 7300. So you can give me a call. And remember, I appreciate you all being on this platform. You're wonderful people, and I know we are learning a lot every Sunday. I appreciate your companionship and continue to support this program. Share the information with other people, that other people will also come on this platform to have eye-opening, the true knowledge of health. Now let's come here to the symptoms of mild cognitive impairment. Now, the first symptom we want to address now is about memory loss. Now, what is it? What does it really mean here? Now, the person tends to forget recent events the person tends to repeat the same questions and the same stories over and over and over and over. And then sometimes you, the listener, you may get tired. You say, why? You told me yesterday or 3 days ago. You were saying again. You told me last week. You're telling me again. Now the person forgets the names of close friends and family members. And the person even forgets appointments and planned events. The person also frequently misplaces items. Compared with the normal aging. With the normal aging, you misplace things too. You misplace your keys. You misplace your phones. But it's not. It's occasional. It's occasional, which is normal, and it wouldn't disrupt your daily life, daily activities. No way. But in my cognitive impairment, it is frequent. See the difference here. Now let's come to language problems. That's another symptom here. Now here with the language problem, the person may be talking. The person has trouble coming up with the desired words. The words you want to use, you can't recall them. You can't bring them to your memory to really use them. So there's a real problem, and the person has difficulty understanding written or verbal, that is the spoken information. So if someone may be talking to you and you find it difficult even to understand what the person, the point the person is trying to make, you find it difficult. Another symptom is about attention. You see, you lose attention easily. You are easily distracted. So you can't concentrate while someone is talking to you or you're doing something. You are distracted easily. And another point is reasoning and judgment. The person struggles with planning and problem solving. So the person may be able to pay his bills or her bills, going to the hospital to grab medication, the prescription, shopping and driving around. The person will do all these things, but with difficulty. Sometimes he may even forget to do them. You see, that's the problem here. But we go on to some further symptoms here. Normally, if you go to an environment that you used to know, maybe you went there a month ago, and you go to that environment after a month, and then you cannot find your way. You cannot actually, you may even get lost. That is another symptom here. And normally, friends and the family members may notice whatever I've mentioned, and the person may not notice it. And the person may be in denial, would not accept that he or she is going through that until there's a point that maybe he would even recognize that a particular thing, maybe there's a dog, and he would even recognize that it's a dog and it's something else. And that's the point that he or she may realize that there's a real problem. So in other words, what am I saying? The symptoms may be very stable for very long time, and it can degenerate into dementia or not, depending on general health and lifestyle. Other symptoms may be depression. The person may easily get angry. The person can be aggressive, and there's a degree of anxiety, and there's apathy. The apathy means lack of interest. The person loses interest in almost everything. No enthusiasm. So these are some of the key symptoms that we should take note of, and we shouldn't forget at all. Now let's move on to causes. What really brings about mild cognitive impairment, MCI? What brings about it? Now, there is no single cause of mild cognitive impairment. That is according to research. There's no single cause. So symptoms of mild cognitive impairment may remain stable, as I'm saying, for years, and it may progress to Alzheimer's disease or other type of dementia. or it could reverse. It could reverse depending on how conscious you are about your health. That is why it's so important for all of us to be health conscious. And if we notice something a little bit, we try to address the problem. You don't just turn blind eyes to something that can degenerate, can get worse. You don't do that. It's not only related to the brain, but also related to other areas of our health. You don't sit down until it gets worse before you take a very serious step. Prevention is better than cure. Now, you see the cause. Research has shown that normally people with MCI, mild-cognitive impairment, they have the same characteristics or similar characteristics of the brain, to those that got Alzheimer's or dementia. It means, what does it mean? They have abnormal clumps of protein. We call that amyloids, the protein. They are plaques that form, they are microscopic protein that it clumps in the brain. And it actually wouldn't allow the brain to function well. So that sort of protein, unnecessary formation of this plaque. But what can lead to that? Blood flow. You see, just figure it out. Look at even a gutter. If you don't have water flowing in that gutter well, to drive away everything in the gutter, to get rid of everything in the gutter, maybe the flow of water, what happens? There's accumulation of debris in the gutter, and it serves as a breeding ground then for mosquitoes, for bacteria, and for diseases. It's the same thing with the blood flow in the brain. When you have a poor circulation, if a person has my stroke is one of the main causes of my cognitive impairment. My stroke, or the invisible strokes, the strokes that you wouldn't even realize that you got. It reduces blood flow through the brain blood vessels, and the blood carries oxygen and nutrients, and every organ in the body needs specific nutrients and oxygen to function well. Every cell in the body needs specific nutrients to work well. And in the brain, we need this vitamin B12. We need omega-3. I'm not saying you go and just buy that. It wouldn't be helpful. You take that through good nutrition. So, thus, blood is the life of the flesh. So if there's a reduction of blood, which many people do have with age, because they have a condition called atherosclerosis, plugging of the arteries. So arteries that carry blood to the brain and other organs become narrower, stiffer, and carries less blood around. So there's a need to clean up the arteries. You need to do that, and there's a way. You just call the number I've put on the platform to have your arteries clean up, so you will be all right. So blood can flow within the body beautifully, and all the organs will also be working well, including the brain. And the research has also shown that is the brain imaging study shows that the following changes may also be connected with my cognitive impairment. That is shrinkage of the hippocampus. Now, what is hippocampus? Hippocampus is simply the part of the brain that is important for memory. So there's a shrinkage. It gets smaller. And so you see, if brain receives enough blood with oxygen and nutrients for the brain cells, it wouldn't shrink. Although with age, our brain shrinks anyway, but you can delay it by 20, 30 years. You can delay it, and you would never have any sign of dementia or any mild cognitive impairment. You wouldn't have any problem at all. So we need definitely to keep blood flowing and to get the right nutrients. And research shows that there's enlargement of brain fluid spaces that we call that ventricles in the brain, and there's a reduction of the use of glucose by the brain cells. You see, the brain cells need energy. They need this glucose. So there's a reduction in the use of that. So that is another factor. Now, what are the risk factors? Who actually gets this? They were saying with age. With age is a factor, but it doesn't mean that everyone will get it. No, it's not part of aging. It's not. It is a disease that affects some people, some individuals. But God forbid, you would never be that individual. Change your lifestyle, have a proper sleep in the night, make sure you digest your food, because aging people have digestive problems to get the nutrients they need. Even if you eat healthy meals and the acid in the stomach is low, you have a low digestive juices, you have a problem. You can't get the nutrients. And if your arteries, with age, the arteries get narrower, stiffer. That is a problem. That's why we say that with age is the main reason. And with age too, we can remove toxins from the body well. That is another problem. A toxic blood cannot flow well. That is one key problem here. So we should detoxify the body, cleanse the organ system from time to time. It's necessary for the body. So that's why we say with age. There are some medical conditions like diabetes. Diabetes make the blood toxic. So diabetes is a risk factor. Diabetes make your blood so thick it can't flow well. It causes atherosclerosis, plugging of the arteries, narrowing your arteries. The brain vessels can be narrowed, can be stiff. Blood cannot flow well in them to the brain. Smoking is a risk factor. High blood pressure. If your pressure is very high, blood pressure is not a disease, but it's indicated something is wrong in the body. So find out what is going on. Elevated cholesterol. Cholesterol is not a disease. If you eat well and your liver function is great, you detoxify your body, you have less inflammation in the body, you wouldn't have issues with high cholesterol at all, because cholesterol is a natural body substance. 85% produced by your liver, so it can be a disease. Obesity normally leads to metabolic diseases like diabetes. Also, when you're obese, what happens? Your heart will suffer. Blood circulation is weaker. All can contribute to this problem. So obesity is not a good thing. You need to reduce weight if you have a weight problem. Depression, if you're depressed, negativity. So it means that even good communication, positive communication is so important. If you talk to negative people, your brain even can be affected. And the lack of physical exercise. When you exercise, you have a blood flow, your heart beats beautifully, blood gets into your brain. And low education, normally we need to challenge our brain. You know, when you go to the gym, you exercise, your muscle is strengthened because a challenge there. We need to actually mentally challenge our brain. Do things, read if you can read. If you can read, work out something that will challenge the brain. Some thinking is really important. Meditation is also very important to really help us to prevent that. Another risk factor is thyroid problem, kidney problem, liver problems can be also a risk factor. Sleep apnea. There are some sleep apnea simply means your breathing can cut off about 5 to 100 times before day breaks. The person next to you is the one that can see that. You can see that. But sleep apnea can be a risk factor for my cognitive impairment. Now, some infections, the side effects of certain prescription drugs, some drugs that are given at a traditional hospital, it can also lead to this problem. Drugs that are used to treat Parkinson's disease or bladder conditions or depression. And also, of course, illegal drugs can also be a risk factor. Autoimmune conditions can also contribute to that. Digestive health, constipatory problem. If you chronically constipate, it means that you don't have good digestive system. It can be a contributor. Head injury can also be a risk factor as well. Blood clots in the brain will not allow your blood to flow well in the brain. Tumors in the brain can be also a contributor to that. You see, so today we've learned a lot. thank you so much for being with me on this platform. I actually appreciate your companionship. Those in Canada, in the US, God bless you. In the UK, God bless you. In Europe, God bless you for joining me today. I look forward to having you around again next week with a brand new topic. Thanks a lot, and God bless you. I'm going to have another good time with you and next week. Goodbye for now. Goodbye.